Hello everybody. I was not planning to make this video just yet. My plan was to make more hormone replacement therapy series, but somebody I care about deeply asked for this topic, and it made me realize that Eid is just around the corner, so maybe there are other people who also have questions about this topic. So here we are. So today we are talking about facial aging and why it speeds up during perimenopause, and more importantly, what you can do about it. So we'll be discussing the causes of facial aging and the corresponding treatments. Hi, I'm Dr. Sophia Kiran. I'm a clinical lab scientist by training with 20 plus years in cell and gene therapy. My passion is to help women, especially Desi women, navigate perimenopause using science-backed education and self-advocacy. All right, first thing first, why does facial aging speeds up around perimenopause? It all comes down to hormones, especially estrogen. Estrogen is basically your youth hormone. So when your estrogen level drops, there are a lot of changes that happen in the body. Unfortunately, most of them are negative. It negatively impacts your bone density, your cardiovascular health, your cognition, and even small things start to creep up, like you have a dry itchy skin, hot flashes, appetite changes, weight gain. Um, so coming back to bone density, which changes with estrogen drop. So it's not only happening in your body, it start also happening in your face. So your facial structure changes, and that causes wrinkles and fine lines, sagging around the jawline and neck, marionette lines, and jowling, hollow temples right here, and sunken eyes. But don't worry, there are a lot of things you can do to slow this down and even reverse some of the signs. So let's tackle these changes one by one. The number one is a bone loss, the foundation of facial aging, which is most surprising cause of facial aging. Usually people do not think about bone loss when they are talking about facial aging. They're usually thinking about the skin, the texture, the loss in the volume. But the signs for aging start like really deep, and it start at your bone structure level. So overall, the structural changes that we are talking about is the shrinking of the jawline, the cheekbone, eye sockets expanding, which is kind of making your eye sit deeper, causing a hollow under eye, which unfortunately cannot be corrected by concealer. So all these structural changes make your face look mature. So if your skin, even if your skin is still smooth. So the question is, what can you do to mitigate or kind of slow down these structural changes? Number one answer for this is hormone replacement therapy. This is your first line of defense. Now, if you are a candidate, and that you'll find out by talking to your menopause specialist, HRT slows down bone resorption, which means less bone loss, meaning a better facial structure preservation. So make sure that you talk to your menopause specialist and see if this is something that's right for you. And that will be under the therapy category for preserving the facial structure. Second thing that we can do along with the therapy, or just standalone, is something very important, is eat bone-friendly nutrients. Make sure you're getting calcium, vitamin D for bone health, and also vitamin K and magnesium to help your body absorb calcium. Now there's a tons of great material available that you can YouTube or Google to see what kind of food you can eat to make sure that you're getting all the vitamins and nutrients needed to keep your bone healthy. Now, third in this category, so we talked about the therapy, the food, and the third is the most important one, is the non-negotiable one, and it's weight training, lifting weights. At this stage, lifting weight is not about looking good. It's not about looking good at all. Actually, the looking good parts happen as a side effect. At this stage, the weight training is done to make sure that your bone density is preserved, and you have the vitality and the strength to kind of conquer this phase of your life. Now, this is a drum that I will beat at every video that I make. You cannot thrive in this phase of life without doing some kind of weight training. And I'm not talking about some bodybuilder regimen. I'm talking about very effective, small 10 to 20 minutes sessions a couple times a week, and that would do the job. Um, and if you're interested, please let me know, and I can make some videos for some upper body, lower body, some core strength that you can incorporate in your lifestyle, along with the therapy, along with eating good food. That will definitely 100% will show some changes in your facial structure. Number two, after talking about the facial bone structure, the second thing that happens that very prominent at this stage is fat loss, and also collagen and elastin loss. So I'm going to lump all these losses under one umbrella because the symptoms are pretty much the same. So you lose volume in your temple area, your cheeks, your face starts to look like a hollow and sunken, and the loss creates what's called the peanut shape. So there's a little dip that you start seeing. That kind of narrows, makes your upper part narrow, and creates sagging at the bottom of your face. So remember, the youthful phase is like an upside egg. So it's narrow at the bottom and it's nice and round at the top. But as you mature and gain more birthdays, it kind of flips. So it becomes narrow at the top and kind of wider at the bottom. So what happened with all these combination of changes is there is a jowling that happened because there's no fat to anchor the skin up. So the skin kind of slides down, and there's a separation between the two fat pads right here. And because of that, you have this skin, this loose skin that starts showing. And then you also have the deeper wrinkles due to lack of volume, and a nasolabial fold starts showing up. So what can you do to restore lost volume? So number one solution will be your old-fashioned derma fillers made out of hyaluronic acid. So these fillers instantly plumps hollow areas and restore shape. They're great for temples, cheeks, and jawline. Recently they have gotten a bad rap because a lot of celebrities showing up with a pillow face, or like looking like Madonna, and nobody wants that. But I believe, like, just for a regular person, if you go to a skilled injector who know what they're doing, chances of that happening is next to nothing, unless this is something that you are looking for. If you're looking for a natural, very subtle changes that can restore your youthful look, I think filler is one of the great options to look into. So the great areas are the temple, cheeks, and jawline. The cost is around $600 to $1,000 per syringe, depending on the area that you're living in the United States. Most people need 2 to 3 syringes for noticeable results. One pro tip that I'll give you is that the key is choosing an experienced injector who understands facial anatomy and who not only understands the science behind the product, but also has an artistic eye, who can look at your face, assess, listen to what you want, and then kind of guide you and to create these subtle changes that can restore volume and give you that youthful look. So that was the old-fashioned fillers. Now we're going to talk about biostimulators. Now these are the category of injectables that are synthetic, so they go into your face, but they stimulate the collagen production of your own body. So these are not, you do not get an instant result from these. They are gradual but long lasting. The first example for in this category of biostimulator is Sculptra. So unlike regular fillers, Sculptra stimulates your own collagen production over time. It's made from poly-L-lactic acid. Is something that's found in the milk. So again, it's injected around your cheeks, temples, jawline, so the periphery of the face. You want to avoid injecting Sculptra in the middle of the face because then if you start building up collagen right in the middle of the face, it will not look aesthetically pleasing. The results take about 3 months to fully show, but they last longer than a regular filler. So the cost is around $700 to $1,200 per vial. Again, it depends on where you get this procedure done. Most people need 2 to 3 vial, which is spaced out 4 to 6 weeks apart. Now, the manufacturer of the Sculptra recommends 1 vial per decade of your life. For example, I'm 45, so my recommendation was 4 vials, but I only got 1 vial. I was sent home. When I came back, all my areas were very nicely filled, so I was considered a hyper responder. And then there was no need for me to get another 3 vials just because I'm in my 40s. And we can also look at the other extreme where you have somebody who is younger in their 30s, but they're a runner, which sees a lot of volume loss. Or if somebody who had lost a lot of weight could also see a lot of volume loss and might need 6, 7, or upward of 8 vials just to restore the volume they lost. So it's highly dependent on on the amount of volume loss you're looking at, and also dependent on the skilled injector who's just not going by the pamphlet that comes with Sculptra saying, okay, you're 40, you get 4 vials. Now, another injectable under this category of biostimulators is Radius. Now, Radius is similar to Sculptra. It also boosts collagen, but it gives more instant results because of its gel-like consistency. It is made from calcium hydroxyapatite. Again, it's suspended in gel, so you get like an instant volume, which doesn't dissipate away. Like in Sculptra, you have a volume for 1 or 2 days, but your body kind of absorbs it, and then you have to wait for your collagen to grow to see a full effect in 2 to 3 months. Period. And the cost is about the same as Sculptra, 700 to 1200 per treatment. You might need multiple treatment. In some areas, the Radius is a little bit more expensive than Sculptra. One thing about Radius is the way it sets the structure, it kind of looks like a bone because of the calcium component in Radius. So there's no way to dissolve it. So you just have to make sure that you go to somebody that is expert in injecting Radius, because once it's in, it's in. There's nothing you can do about it, even if you don't like the changes that it has caused. Now, the most common areas that is injected is in jawline, neck, and the back of the hands. We talked about derma fillers, biostimulators. Now we're going to talk about natural collagen boosters like PRP and PRF. Now, PRP is platelet rich plasma and PRF is platelet rich fibrin. Uh, this procedure uses your own blood to stimulate collagen production. Now, with Sculptra and Radius, you're still producing your own collagen, but there's a synthetic substance that's been injected into your skin in order for that to happen. With PRP and PRF, you walk into the facility, they draw your blood, they spin it at different speeds, temperature, depending if they're making PRP or PRF, and then they extract the layer that has stem cells, white blood cells, all the good stuff, and then they inject that into your face. Now, that's great for fine lines, texture, overall skin health. The drawback of this is that it get absorbed into your body really quickly because it comes from your body. Now, if you're getting it for volume restoration, is really not a good option because it's going to go away in a couple of months. But if you're doing it to kind of rejuvenate your skin texture, this is something that you can look into. The cost is usually around from $500 to $1,000 for PRP. PRF is slightly expensive because it's considered a step up from PRP. So PRF contains more stem cells, like more white blood cells, and it offers a longer lasting results. Many clinic offer package deals, like for three treatments for $1,500, or 4 treatments for $2,000. What I would recommend is that you get one treatment and see how your skin reacts, how your body reacts, if you like it or if you don't like it. And if you do end up liking it, you can go ahead and purchase a deal. Now, one thing about packages, if you go somewhere and you feel like somebody is pushing packages on you, run out the door. Don't even entertain the offer, because people who know what they're doing, they will listen to what you want, they will give you an option that's available at their facility, then they will give you your space and you make a decision. But if you feel like people are pushing all these procedures and packages especially, that you don't want to get looped into a situation where there's a treatment done on your face and you don't like it, you have to go for a second or third treatment because you paid for it. Now we're going to talk about a brand new treatment that can restore your fat cells naturally. It's called Renuva. Renuva is a new fat restoration treatment, and it's the only treatment I know that's available that restore your fat cells. All the procedures that we have talked about, like Sculptra, Radius, PRP, PRF, they all stimulate your collagen. They're doing nothing for your fat pads. Renuva is something that helps regrow your own fat pads. So they are made from stem cells. They are acquired from healthy donors. So healthy donors, they take the fat from that person, then they extract or they harvest stem cells. Those stem cells are used to produce Renova, and then Renova is injected into your face, and hopefully that renewal will help to regrow your own fat pads. Um, the results take 3 to 6 months to fully appear, but are long lasting. The cost is, I've heard, is around $1,500 to $4,500 per treatment, and you might need multiple sessions for that. Now, last but not the least, we're going to talk about neurotoxins like Botox, Dysport, Xeomin. So there are different brands, but they're all under the category of neurotoxins. These treatments temporarily blocks nerve signals to the muscles, preventing them from contracting, then which smooths out the wrinkles. So just imagine, like, if you keep folding a piece of paper over and over again, you will create a crease. Now if you take a neurotoxin and apply it to this piece of paper, and then this piece of paper cannot fold because it's been temporarily paralyzed, the crease that was created eventually will just fade away. So the best areas for administering a neurotoxin is forehead lines, the crow's feet, and the 11th between your brows. Now, one quick tip about the forehead: if this is the first time you are getting Botox in your forehead, be very, very conservative, because what happens if you get too much, this entire area can like drop down, and then you will end up looking like mad and sad, and you don't want that. And the Botox stays in your system, not in your system, in your muscles, where it's injected 2 to 3 months. So you have to wait 2 to 3 months for the Botox to wear off. So be very careful. I personally, I do not do Botox in this area. I have this wrinkle that appears right here that bothers me a lot, so I just get this area treated. One thing that I found out during the Botox session is that my eyebrows were uneven. So this brow sit higher than this one. So my injector, who is amazing, and I love her, she kind of, did some units under the eyebrow right here to even it out, and I just could not believe what a huge difference it made once the eyebrows were kind of evened out. So another procedure that, which is famous for Botox, is that if you feel like your corners of your mouth are turning downwards, you can have this little triangle area. It's called the DAO, Botox. It will help the muscle relax here, and then subtly it will lift the mouth corners, and that can make a huge difference. Another procedure famous for snatched jawline is called the Nefertiti lift. So neurotoxins placed along the jawline and the pituitary glands, the pituitary bands. Um, so they get more pronounced as you age. So these can be Botox, but very, very careful if you overdo these with Botox. It will be very hard for you to lift your head, especially when you are exercising. If you're praying, you go in sujood, it's like really hard. You will be dragging your, it's a very weird sensation. And that's why, even though I like the results, I never went back for another Nefertiti lift, because it was just too much Botox, and I just did not like the sensation. But some people love it, and that's something that if you're interested, you can look into. So for the results, again, last 3 to 4 months. I personally, I do not get Botox back to back. I try to give my muscles some break. I let the movement come back, because if they're constantly being paralyzed, I feel like they will just wither away, and that's not a good thing. So I do like a session once every 6 months, and my plan is that I'm training my face not to make too much expressions, so I can go like even longer between Botox session. So what are the cost for this? So it can be anywhere from $200 to $500, depending on what area and how much units you are using. And again, it's once every 2 to 3 months. So let's recap everything that we have covered. So for the treatment, we started with HRT, which slow down bone and collagen loss. We talked about hyaluronic acid filler, which instantly restore lost volume. We talked about Sculptra and Radiesse, which stimulate collagen for a long-term results. And then we discussed PRP and PRF, which boost collagen naturally. This is a product from you going back into you to kind of give you the skin rejuvenation or some volume restoration. We talked about the most advanced or recent treatment, Renova, which regrows fat that is lost and is long lasting. We talked about Botox that smooths fine lines and prevent deeper wrinkles. So there are so many amazing treatments out there, but the key is knowing your options, knowing your face, and then working with a skilled provider. So in next video, I'm thinking to cover the AM/PM skincare, the devices like at office or in-house devices to keep your skin youthful and healthy. So thanks for watching, and I'll see you in the next one. Bye.